Hey nurses, congratulations on passing your NCLEX. And if you're still about to take it, congratulations on making it this far. You've got this. You've worked incredibly hard to reach this point, and now you're officially a registered nurse or about to become one. So take a moment to let that accomplishment sink in, and honestly, celebrate your hard work. It's a great time to reflect on your journey and really be proud of what you've achieved. But don't relax for too long because there's still more to come. In this video, I'm going to guide you through your next steps to landing your dream job, refreshing your clinical skills, and start building a strong foundation for your nursing career. So let's dive in. So the first step is to decide where you want to work. Do you see yourself in the fast-paced world of the emergency department, or maybe the nurturing environment of labor and delivery, or perhaps the critical care unit, or maybe even med-surg? Or what if you don't see yourself in the hospital setting at all? Maybe you want to be a cosmetic nurse and inject Botox, or maybe you want to jump straight in to your NP schooling, that nurse practitioner training. Trust me, I hear this a lot. So if you don't know where to start, then do this first. Make a simple list of specialties that you're interested in. Then I always recommend researching different healthcare facilities, and here's the big key. Pay attention to their mission, their values, and work culture. To be honest, this is probably the most important thing to do. Because speaking from experience and having been in the industry for a long time, a toxic work culture can crush your spirits and lead to a very frustrating new to nursing experience. So if you're gonna go into the hospital, please be sure to do your research and do your best to ask other nurses who've worked on that unit that you're considering. I have heard the worst stories, and you can probably see some on Reddit. So remember, don't be scared, be prepared. You have to remember that you need to protect your license, protect yourself, and your future patients as well. So I always recommend interviewing the hospital before the hospital interviews you. Now, the best way to do this, as mentioned before, is to simply talk to other nurses on the unit, and maybe even take a tour. You can also research it in blogs, or you can simply consider a residency program. There's many top-tier hospitals that offer new graduate nurse residency programs, and it's all designed to help you transition smoothly into your role as a new nurse. These programs provide mentorship, extra training, and even skill-building opportunities. They usually last about 3 to 6 months, but can even last up to a year. Now, the next step is to refresh your skills for the hospital or clinical setting. While nursing school kind of prepared you, hands-on practice is absolutely essential. So I always personally recommend to spend some time reviewing a few basic skills. For example, starting IVs, medication administration, Foley placement, even wound care, and all the vital signs. And as a little side note, we've done all the hard work for you and included all the top skills into bite-sized video formats so you don't have to search random videos on YouTube. Also, it's great to run through critical thinking scenarios, like case studies to test your decision-making in different scenarios. So brush up on infection control measures and patient safety guidelines. Now, many hospitals have simulation labs and even refresher courses available. So if you have access to these resources, I'd recommend to use them. If not, then consider investing in online courses or even workshops to make sure your clinical skills are sharp, which we have you covered in our new Grad Nurse Mastery series. So this amazing course and membership we'll be talking about at the end of this video. But first, let's talk about how to prepare your job application. First, your resume and cover letter should highlight your clinical experience, any certifications you have, and any leadership roles that you've held, whether it's related to medical field or not, or even volunteering. So I recommend to tailor each application to a specific role that you're pursuing, and be sure to include, number one, a professional summary that captures your passion and commitment to patient care. Number two is your clinical rotations that align with the job description. Next is soft skills like communication, teamwork, and even adaptability. Now, trust me, these are absolutely critical for any nursing position. Next is the interview process. In our new Grad Nurse Mastery course, we sat down with some of the top hiring managers from 3 big hospitals in the country, and we had them reveal all their secrets on what they look for during the interview process and also what interview questions they use to screen their applicants. This is literally a behind-the-scenes look on what the hiring process actually looks like. and it's all included in our new grad prep course. So use those videos to practice your interview skills and be ready to answer common questions. For example, tell me about a time you had to handle a difficult patient, or even how do you prioritize tasks during a busy shift? Now, these are only 2 examples of common questions that come up during the interview process. Now, as a bonus tip, connect with nurse recruiters on LinkedIn or even join nursing groups where you can network and learn about job openings. Another big thing to remember is that once you start your new job, you'll need to keep your nursing license active. So that means earning continuing education units, or CEUs, to stay up to date with best practices and advancements in healthcare. And it all depends on the state that you're licensed in. So here's how you can earn your CEUs. Number 1 is to attend nurse conferences or even workshops. Another way is to complete online CEU courses on various platforms, like Elite Learning or through your hospital's education department. Now here's the best part. Simple Nursing has actually partnered with Elite Learning to make getting your CEUs simpler and a whole lot more fun. Our new Grad Nurse Mastery course is available on Elite Learning, along with a membership that actually includes a CE library with everything you need for license renewal, including fun podcasts and videos with interesting topics that you'll actually care about as a new grad. So many times, other CEU platforms can be downright boring and really a drag. So staying engaged in continuing education not only keeps your license active, but also helps you grow as a nurse. So remember, passing the NCLEX is simply the first step in your incredible journey as a nurse. So remember to be patient with yourself, seek out mentorship, and continuously learn and grow. Your dream job is waiting for you, and with dedication and preparation, you'll thrive in your new role. So to help you thrive in transitioning from nursing student to working as a nurse, we've partnered with Elite Learning to create this new Grad Nurse Mastery course. And right now, I'm going to give you a behind-the-scenes look. We've packed in here interview tips from top hiring managers from around the country, and also resume builders to help you land your dream job. Next is skill refresher videos, right on your phone when you need a quick refresh. Now, it comes in super handy when you're about to do a skill that you've never done before. Simply pull up a refresher video and get step-by-step guidance. Next is expert strategies for conquering that new job anxiety. Plus, you get CE credit for courses as you learn. Talk about a 2-in-1 combo here. So here's how you get access. You can get my new grad course either by itself or as a part of an Elite Nursing Career Passport membership, where you'll get access to even more new grad skills videos, live Q&A sessions with nursing experts like me, and a whole library of fun CE content in convenient formats, like podcasts and engaging videos to help you maintain your license. Now you can find out a whole lot more about this course and all the resources for new grads in the career section of your Simple Nursing dashboard. So once again, congratulations on passing your NCLEX. You deserve it. And if you haven't taken your NCLEX yet, here's a congratulations in advance, because I know that you're gonna pass. So go out there and make a difference in the world of healthcare. You've got this. Lastly, thank you for watching, and don't forget to like and subscribe for more tips and guidance on your nursing journey. Until next time, take care and keep learning.